Hi, my name is Angela Thompson, and I am a board-certified nurse practitioner specializing in the care and management of diabetes. And November is American Diabetes Month, and it is also the time of year where colds and flus and other respiratory illnesses tend to be very common. So today I wanted to talk with you about 4 ways you can better manage your diabetes when you have an acute illness like colds, like flus, or even COVID in particular. Let's talk about my first recommendation. It's around glucose monitoring. It's very important that you are checking your glucose levels at least every 3 to 4 hours during an acute illness. And it serves several purposes. One is that it will help your nurse practitioner managing your diabetes evaluate if there needs to be changes in your diabetes medications or even to some degree other medications, and how you might have to alter your food intake during this time. It also will help you understand the changes that occur during the illness. If your glucose levels are consistently over 150 or if you're vomiting, then you absolutely would consider checking them more often than the 3 to 4 hours, possibly every 1 to 2. Second, get to know how and when to adjust your medications. Most medications that are prescribed for diabetes management can absolutely be continued during an acute illness and should, and that's including insulin. The only exception is if you're really nauseated and you're vomiting and you're not able to keep the medications down, you need to call your provider that's managing your diabetes, your nurse practitioner that's managing your diabetes. One of the biggest mistakes that individuals make with their medications is stopping them. So oftentimes if they're feeling ill, they're not eating as much, they stop their insulin and their medications, and that can actually lead to really skyrocketing glucose levels and sometimes unavoidable hospitalizations. Third, I can't stress enough what kinds of non-prescription medications need to be evaluated to determine whether they are safe to take during your illness for your diabetes. As a rule of thumb, if the over-the-counter medication is in the form of a gel or a tablet, then it's usually safe. It doesn't contain additional carbohydrates or alcohol, and so it's unlikely to affect your glucose levels. Typically, liquids, however, are different, and they do contain carbohydrates and alcohol, so it's usually recommended to avoid it. However, if you just have a favorite liquid or something that works well for you and you're not sure if it contains those ingredients, then you can either call the manufacturers or you can go on their website and oftentimes find the ingredients. Fourth, know when it's time to contact your nurse practitioner or other healthcare provider managing your diabetes. In particular, if you're experiencing symptoms like vomiting more than once, fever of greater than 102.5, if you have abdominal pain, or if you have irregular breathing, those are really concerning signs and signs that indicate you really need to reach out to your provider for help and further guidance. Managing diabetes can absolutely be difficult, but I believe these 4 tips can help you control your glucose levels even when you're battling a cold, when you're battling a flu, or another type of illness. Absolutely, if you need support in managing your diabetes or another aspect of your health, consider a nurse practitioner. You can go to wechoosenps.org to learn more, and absolutely stay healthy and well this winter season.